Good evening, I'm Adrian Arsenault.
And I'm Andrew Chang. Tonight, a dire prediction. Canada could see 60,000 COVID cases a day by next month. CBC News has learned Dr. Tam has briefed Canada's leaders. We have the breaking details.
Also tonight, millions of Canadians are living under new restrictions as provinces desperately try to beat back the second wave.
These measures, they will have to be tough.
The right to shop is not as important as the right to life.
We need to take more action now.
Cases surge, provinces clamp down. What's changed where you live?
And Quebec offers a Christmas contract.
It gives us hope. This is something that I think it would be well worth it.
Get together, but stay home afterwards. Will that work?
Plus, what a group of teenagers in Yukon did.
A group of kids did something super powerful.
This is The National. New COVID modeling numbers from Canadian public health officials will come out tomorrow. But tonight, CBC News has an early look, and those numbers are pretty startling.
We're getting a clearer picture of just how bad this could get and how quickly it could happen.
So take a look at this. If Canadians increase their contacts, as in see more people each day than we're currently seeing, the modeling says new infections of COVID-19 could reach 60,000 a day by mid-December. If we maintain our current number of contacts, daily infection numbers could still quadruple.
Now, David Thurton broke this story for us tonight. He shows us why staying the course just isn't an option.
Fires are burning in so many different areas.
The warnings have been clear.
But we have to do our part to flatten the curve before it gets any worse.
And now a grim reality. CBC News has learned new federal modeling will suggest if Canadians keep doing what they're doing now, we're on track to see over 20,000 cases a day by mid-December. And if we increase the current number of people we contact each day, daily infections could surge to 3 times that.
You hear a number like 60,000 new cases per day. I mean, that's an overwhelming number. But even if we maintain the status quo, that's still not acceptable.
For the first time, the Prime Minister met with all the opposition leaders for an advance briefing before the numbers are made public.
This is an incredibly urgent situation. It is one that we do not have a handle on.
The fact that the numbers are really troubling. I'm deeply worried about people.
Under these models, even staying the course will have dangerous repercussions for the healthcare system.
Many places, for example, are starting to cancel elective surgeries. And, even maintaining 20,000 new cases per day is not sustainable.
To drive that number under 10,000 cases a day, experts say Canadians need to limit interactions to essential activities and adhere to physical distancing rules. On Friday, the Prime Minister will speak about these new forecasts from the steps of his home. He hasn't addressed Canadians from there since Canada was in its first wave, a sign of the urgency of his message. David Thurton, CBC News, Ottawa.
Now, Conservative leader Aaron O'Toole was in that briefing as well. He released a statement tonight saying Canadians need to see a real plan to test, trace, and isolate those who are infected. Shutting down the entire country again is simply not a solution.
Now, those projections were not public today when the Quebec Premier announced a hopeful plan for a merrier Christmas. He will allow holiday gatherings in a hard-hit province that even today saw 1,207 new cases. It is a gamble, but he's asking Quebecers to enter into a sort of contract. Alison Northcott shows us how it'll work.
Kate McGowan is looking forward to finally spending time with her family after nearly 2 months of heavy restrictions with most social gatherings off limits.
My mother's been living alone, and it'll just be nice to be able to finally give her a hug for the first time since March. So, yeah.
Quebec Premier François Legault is proposing what he calls a moral contract for the holidays. The province will allow get-togethers up to 10 people over a 4-day period, but he's asking Quebecers to agree to a voluntary isolation.
We ask people to limit their contacts as much as possible a week before and a week after.
To provide time for some to isolate, students will be let out of school a few days early, a week before Christmas Eve. Elementary schools will resume as planned just over a week after the gatherings, but high school students will do online learning until the following week.
because we didn't want to lose that time with our students. We didn't want the interruption in the learning to be extended.
The concern for this infectious disease specialist is that December gatherings could lead to a spike in cases in January.
What we would not want to see is an explosion of COVID cases that would jam-pack our hospitals.
That also worries Carlos Bergaman.
They're looking for troubles. I mean, they try to please people to pay later.
But others are eager for a little reprieve.
It gives us hope, and I missed our birthdays, I missed Thanksgiving, so this is something that I think it would be well worth it, all those times that we missed.
The province's public health director says the fewer gatherings there are, the better, and says the plan to allow them is a controlled risk. Alison Northcott, CBC News, Montreal.
So it's a different story tonight in Ontario, Manitoba, and BC. As case numbers keep spiking, governments in those provinces are bringing the hammer down now. Millions of people, representing roughly half of Canada's population, are facing new restrictions tonight. So let's begin with Briar Stewart in BC. After posting another, 538 new cases today, Briar officials seem to have brought in the toughest measures yet, right?
Yes, and BC's sweeping new measures will extend current restrictions and add new provincial health orders. And after weeks of mounting pressure, masks will now be mandatory in all indoor public spaces. Many business owners had been pleading for a mask order as some customers were still turning up without them.
If it's mandatory by BC, then we can strictly enforce the law and stop the person at the door.
Now they will be mandatory, and social gatherings will be restricted across the entire province.
But we need to take more action now.
The province has also ordered places of worship to no longer hold gatherings inside, except for weddings and funerals where there can be a maximum of 10. While there hasn't been any reported COVID cases at this synagogue, there have been at other religious gatherings.
They did say that the spread of the virus has become exponential, and they really need to get ahead of this before the hospital system is overwhelmed. And we're very on side with ensuring that safety is a priority.
The province is going to step up enforcement, including at pubs and restaurants, to make sure they're following the rules. But many fitness facilities remain closed. The province considers intense group activities like spin class high risk, so they will stay shuttered.
We are in our second surge.
Others may be able to reopen, but they need to submit a new safety plan, and they're still waiting for the guidelines.
Stretch is a business that employed 19 people. My partner and I, we've been working, without any wages, collecting our CERB, with the hope that in the future we'll have a business to come back to.
So Briar, curious about something. BC got a lot of praise for how it handled outbreaks in the long-term care homes back in the spring, but with the new outbreaks, what's happening on that front?
Well, Adrian, that's a measure of particular concern because despite the measures that BC has already put in, there are nearly 60 outbreaks in healthcare settings, and dozens of those are in long-term care homes.
All right, Briar Stewart in Vancouver tonight. Thanks, Briar.
Now, Cameron McIntosh is in Winnipeg, where officials announced 475 new COVID-19 cases today, prompting what the province calls the toughest retail restrictions in Canada. So, Cameron, what are Manitobans looking at exactly?
Well, Andrew, as you can see, it's snowing here in Winnipeg tonight. Tomorrow, you'll still be able to go to the store and get a shovel or some boots, but forget about a new TV or anything that's not on this list.
You can still go shop for food, personal hygiene products, along with cleaning goods, building materials, car parts, and winter clothes too. But Kirsten Sigfusson is getting her new 55-inch in just under the wire.
When I'm on break for the next 2 weeks and don't have anywhere to go because of the code red, I mean, it's nice to be able to watch TV.
Don't go in and buy a head of lettuce so you can get a color TV.
In a province with the highest infection rate, the Premier says too many people, too many stores are taking advantage of essential shopping exceptions for non-essentials.
We are here to discuss new and stricter measures, including ensuring that only essential items are purchased in person.
Andrew Parks owns a tailored menswear shop. He's been closed, as mostly big box competitors have been allowed to sell similar items.
I think that
It's righting a wrong that should have been addressed in the original closures.
Stores that are open have to reorganize themselves. There are concerns health enforcement will now fall to clerks and cashiers. Back in the parking lot,
I think it's kind of silly because there's lots of people who run out of things.
People don't need to be out buying TVs and stereos at this, at this time, in the middle of a pandemic.
Pallister and Russin have been saying that for weeks, getting visibly more frustrated as COVID cases and deaths keep rising.
These are not just numbers that I'm announcing every day, right? These are people, these are Manitobans.
The right to shop is not as important as the right to life.
Now, tonight in Winnipeg, there were big lineups outside of several stores after people were asked explicitly not to do that. And I should mention, these laws or these rules don't apply to online shopping. As for how long this will all last, Andrew, well, the province is saying at least 2.5 weeks, possibly longer, if the COVID numbers don't come down.
Okay, Cameron McIntosh in Winnipeg, thank you.
Now, Katie Nicholson is in Toronto, where Ontario reported 1,210 new cases of COVID-19 today, and the Premier warned some tough new restrictions are on their way. So, Katie, that announcement is coming tomorrow. What's the mood tonight?
Well, Adrian, here in Ontario, it feels like much of the province is holding its breath in anticipation of what's to come, and many are bracing for the worst.
Christmas is coming, and so are more restrictions. And for small retailers who depend on seasonal sales, it's going over like a lump of coal.
It's really, really scary.
Sam Carre is now trying to put her entire store inventory online ahead of the holiday rush and another possible lockdown.
It was so time-consuming. It was a lot of work.
Tomorrow, our government will release further public health restrictions based on the best medical advice. And as it's looking, these measures, they will have to be tough.
The province is on the cusp of a critical threshold. Nearly 150 people with COVID-19 are in intensive care tonight. The province says if it spills over, it could threaten its ability to maintain adequate critical care services. ICU staff are already feeling the pressure.
The teams are tired and people are stressed.
In COVID hotspots like Peel Region west of Toronto, tacit understanding things need to change.
Some sort of pause is needed to at least reduce interactions and bring our case numbers down.
Whatever that pause entails, the province is signaling it won't include school closures.
The safest place for our children right now are actually in the schools.
That leaves retailers like Carre feeling even more vulnerable.
I need to be here to be able to make my business survive.
I'm actually worried about you because of everything that's going on. So treats for your staff.
A reminder, no matter what tomorrow brings, we're all in this together.
So, Katie, the Premier Doug Ford called out the rule breakers today. What is the province actually doing about that, though?
It is stepping up enforcement, sending about 200 inspectors out into the community to crack down on what it calls bad actors.
Okay, Katie Nicholson at Queen's Park. Thanks, Katie.
Now, there are also new restrictions in New Brunswick tonight.
We have recommended that Zone 1 transition to the orange phase of recovery due to the increasing number of cases we are seeing in that area.
That means the Moncton region will see tighter restrictions effective midnight tonight. The case count has doubled in the past week in the province. There are 4 new cases today. And Alberta broke yet another single-day record with more than 1,100 infections reported today. 8 more people have died from the disease. 284 people are in hospital. The crisis has also hit Alberta's oil sands, where there are currently 6 active outbreaks.
So let's move to other news developing across the country, beginning in northern Ontario, where a call to police resulted in 2 people dead. A civilian and a veteran police officer shot and killed in the line of duty. Ellen Morrow now with what we know so far and the reaction from a community in mourning.
Constable Mark Hoving was a 28-year veteran of the Ontario Provincial Police, a family man well known in his community, now reeling over his loss.
It's devastating for the whole community, and I cannot imagine what his family will be going through.
The shooting happened in Gore Bay, 6 hours northwest of Toronto. Hoving was called to a property around noon to investigate a report of an unwanted man, says Ontario's Special Investigations Unit.
Soon after officers arrived on the scene, they encountered the man and there was an interaction.
Hoving was fatally wounded. The man on the property was also shot and died in hospital. His identity has not been released. Hoving's killing being felt deeply by officers across the province.
When an officer dies in the line of duty, it's like you've lost a family member. It's just very tragic and very sad, and you almost feel numb, and you can't get the feeling back.
Hoving is the first OPP officer killed in the line of duty in a decade. A tragedy compounded in this tight-knit community by COVID, robbing the solace that comes from mourning together.
Everyone's going to be suffering, and especially now where you can't gather with your community and just sit and talk.
Today's tragedy marked in the provincial capital too, the flag at Ontario's legislature flying at half-mast. Back in Gore Bay, the town's mayor asked for prayers for Hoving's family.
The family and everyone involved in their thoughts tonight, and give your family a hug.
Hoving was 52 years old. Ellen Morrow, CBC News, Toronto.
Now, while the OPP is in mourning tonight, the RCMP is facing a moment of reckoning after a former Supreme Court justice described the force as a toxic culture rife with harassment and assault. Now, his report doesn't hold back, saying this culture encourages or at least tolerates misogynistic, racist, and homophobic attitudes. The problem is systemic in nature and cannot be corrected solely by punishing a few bad apples. Justice Michelle Bastarache called the stories he heard shocking. Ashley Burke brings us the disturbing details.
She finished her career as one of the RCMP protecting former Prime Minister Stephen Harper. But in the years leading up to that, she says she was tormented by her male co-workers.
The sexual assaults, the inadvertent tearing my top open and reaching in and grasping me by my breast, things like that. There's so many. You could go on and on and on.
Linda Gillis Davidson spent almost 30 years on the force, leaving in 2012. She says she dealt with demeaning comments, unwanted grabbing, and crude pranks.
They had actually taken tampons and dipped them in ketchup and hung them from the coat hangers.
Davidson was one of the lead plaintiffs in a class action lawsuit at the center of a new damning report. It's filled with hundreds of other women's haunting accounts. The report, written by former Supreme Court Justice Michelle Bastarache, states, the level of violence and sexual assault that was reported was shocking. We heard stories of women who sat with their service revolvers in their mouths and were only stopped from killing themselves when they thought of their children or their pets.
If an organization cannot keep its own members safe from harassment and discrimination, how can Canadians have confidence in them to keep them safe as they enforce the law?
When Trudeau hired RCMP Commissioner Brenda Lucki, her mandate was to change the culture of harassment. It's something Lucki says she's experienced herself.
It's touched me very personally, and actually today has been a very emotional day. But this is exactly why I took on this job. It's really just deepening my resolve to do better, and it's putting fuel in my fire.
Lucki says change is hard, but it is happening. The report's key recommendation is an independent review into the future of the RCMP, something that no one's committed to yet. Ashley Burke, CBC News, Ottawa.
The federal government has revealed a long-awaited campaign promise, legislation to set binding climate targets to get Canada to net zero carbon emissions by 2050. But as Salima Shivji tells us, there is criticism that the first goalpost is too far away.
Net zero greenhouse gas emissions.
It's a promise the Liberals made more than a year ago. On the campaign trail as they try to position themselves as the party to lead Canada on climate action.
We'll legislate 5-year targets along the way.
Clear targets to reduce Canada's carbon emissions enshrined in law, to compel this government and future ones to live up to their climate promises. The bill would require progress reports and set up an independent advisory board to give advice on how to meet the targets.
On a rolling basis, every 5 years between 2030 and 2050.
But the first legally binding target would be 10 years from now, in 2030, not 2025. And if the government fails to meet it, there aren't any penalties. That's an issue for many environmentalists who see the bill as a landmark step that needs to be stronger.
And we need to shift some of that emphasis over to the minister responsible achieving those climate commitments and there being consequences attached.
And here's the thing. Canada has never once met any of the emissions reduction goals it has set, and it's not on track to meet the current one.
Why did you not include more accountability in your climate accountability bill?
There is a tremendous amount of transparency and accountability required, but ultimately the accountability for government's actions or inactions is from Canadians themselves.
The Prime Minister leaving that to voters, but he does need the votes of at least one opposition party to get this bill passed, and they don't seem too impressed.
There is very little accountability, and it's really just a game of smoke and mirrors.
This bill has no target for the next 10 years.
All eyes now are on when the Liberals will reveal their plan to meet and exceed their 2030 emissions reduction targets, a plan the government promised to release immediately back in September. Salima Shivji, CBC News, Ottawa.
A Canadian cancer patient is speaking out, desperate for a quarantine exemption.
If I don't go to the States, I won't get treatment and I'll probably die.
Next on The National, a CBC News investigation into a life or death situation.
Are Canadians getting price gouged for pandemic essentials? A marketplace investigation.
On store shelves, your product.
That's unacceptable.
And the Yukon high schoolers making history.
You never hear that happening. A group of kids did something super powerful.
We're back in 2. Welcome back. A follow-up tonight to CBC News investigations that found at least 3 senior U.S. executives skirted quarantine rules this year. The government says 2 of those shouldn't have happened, but as Jonathan Gatehouse reports, that's no comfort for one Canadian who says he's been denied an exemption, even in a potential life or death situation.
This is how Dean Nixon spends every other Monday. He boards a plane, wipes it down, and travels to Bethesda, Maryland for life-saving medical treatment. Nixon has stage 4 anal cancer and is part of a clinical trial that's only available in the United States.
3, 2, 1.
He gets an infusion of immunotherapy drugs every 2 weeks, and when he returns home to Canada between treatments, he has to quarantine.
I just keep doing what I can do, but it's extremely frustrating. My situation is just a blanket, sorry, you're in quarantine.
Since October, Nixon's been caught in a cycle of treatment and isolation, one that will continue for the next 11 months unless someone changes the rules. There are a number of exemptions to Canada's quarantine rules for essential workers, for people coming here to seek medical treatment, and on compassionate grounds. But Nixon's been told by health and border officials that none of them apply to him. Just a few kilometers east of Nixon's apartment, his work. He's a horse trainer, and he should be at this farm every day caring for the animals. Nixon has an employee who's looking after the horses. But some clients have already left, and he's worried he'll lose his livelihood.
If I don't go to the States, I won't get treatment and I'll probably die. If I don't go to work, I can't afford to go to the States and I'll probably die.
My understanding is that
Julia Strauss is the physician overseeing Nixon's clinical treatment in Maryland.
I'm concerned about his mental health, also concerned about the financial hardships that he has and not able to do his job.
Nixon is the only Canadian patient in this trial, a unique situation that isn't easy to accept.
For me, I really just would like to be able to go to work, maybe take my dog for a walk, and that's about it. I'm not asking for a lot.
Just a solution that allows him to save his life while living it.
And Jonathan Gatehouse joins us now. So Jonathan, certainly totally grueling time for Dean Nixon. What are officials saying about his situation now?
Well, not much. Adrian, we reached out to the Canada Border Services Agency, who said that they just enforce the rules, they don't draw them up, and they sent us to the Public Health Agency of Canada. Now, we have yet to get a response from them, but what we've been looking for here is an explanation of why a rule would exist that it would exempt people coming into Canada for medical treatment, but not those who go abroad for it. And as I said, we're still waiting for an explanation.
All right, I know you're going to stay on it. Jonathan, thank you.
Thank you.
Now, in the U.S., the number of patients hospitalized with COVID-19 has jumped by nearly 50% in the last 2 weeks. With more than 250,000 Americans now dead, officials are now pleading with people to stay home this Thanksgiving. Stephen D'Souza begins in New York, where schools are being shut down.
With coronavirus cases creeping up in New York, parents questioned why the largest school district in the country was shut down, while most everything else remained open.
I'm unable to work. I had to take a leave of absence, and my company doesn't pay me. So how am I supporting my child? It's a domino effect. It's a disgrace.
Kids could go into a restaurant where they're serving pictures of margaritas, not wearing masks, but they can't walk 4 minutes to their local school where all the kids are socially distanced and wearing masks. How fakakta is that?
New York was once the epicenter of the pandemic. It's now among the safer places in the country. The virus is running rampant in the Midwest, where the rate of new cases is among the highest in the world. Some states are responding by making masks mandatory. Others, like South Dakota, are not.
But if people choose not to, we still should treat them with respect and understand that they're making a personal decision.
Some hospitals in the Midwest are reaching capacity, yet exhausted and overworked doctors say they're battling COVID denial.
Patients dying with it, denying that it exists. I have family members that deny it exists, and it's hard to have that conversation with them.
At the White House, the president's task force made a rare appearance, asking Americans for a final push, touting that vaccines are on the horizon.
We need all of us to go all in. Go all in with face coverings, social distancing, hand washing, smartness about crowds.
While the doctors warn that cases are rising faster than in the spring, the vice president promised the country is rounding the corner. Then he left without taking questions.
Thank you all.
The first briefing since July ended with reporters questioning why, after calling on all Americans to work together, those at the podium are still not working with the incoming Biden administration. Stephen D'Souza, CBC News, New York.
Well, ahead tonight, a CBC Marketplace investigation. From toilet paper to hand sanitizer, what happened to promises to crack down on pandemic price gouging?
Next, though, Rosie's here with that issue.
Adrian, premiers are coming out with some pretty strong messages for their citizens, for their populations. Tonight, we'll look at what leadership during the second wave looks like and whether one premier is having more political success than others. Chantal, Andrew, and Althea will join me right after this break.
As I've said before, this is a team effort. It's a Team Ontario effort. We need every single person, every single household, and every single business doing their part.
Remember that the team is only as strong as its weakest link. I implore you, do the right thing. Get on the team. Manitoba's counting on you.
Just some of the provincial team reaction as provinces remain under increasing pressure to lock down their economies and to better handle the pandemic as cases of COVID-19 continue to climb there. But is one premier leading the pack, leading the country in terms of their response, in terms of political leadership? What do Canadians need to see more of from their premiers and from their representatives? It's Thursday, and I'm here with At Issue, Chantal Hébert, Althea Raj, and Andrew Coyne. Good to see everybody tonight. I know we've talked a lot about COVID, but it does seem this week again as though provinces and premiers have now in many ways sort of responded to what the Prime Minister did last week, which was say, hey, we need to do more here. Is there a province at this stage, let's take the Atlantic part out of it because they're sort of in a world of their own, happily. Is there a province who is leading better than others? And I'll start with you, Althea.
Well, leading better is a hard thing to say because, frankly, what measure do you use? Do you use the number of COVID cases? Do you use their communication style? There are clearly premiers that are doing less well than others. I think specifically of Jason Kenney in Alberta, for example. Polling numbers suggest that people in that province believe the premier is not doing a great job either. But I don't know that now is really the right time to say who's doing best and who's doing worst. I think We can talk about the different styles of the premiers. Like, it struck me today hearing Premier Legault that he's like pleading with people to please follow the rules. And Doug Ford is more like, hey, like, I'm going to come down tough if you don't do this. So you kind of see people's personalities a little bit. But I can't honestly say that one premier is doing a far better job than the others because they're really facing different circumstances.
Yeah, I wonder too, though, Chantal, whether provinces like Manitoba, Saskatchewan, and Alberta that were not hit in the same way in the first wave are struggling because the second wave is actually much worse for them. And so it becomes difficult for premiers to know how to respond, given that they weren't given the same opportunity as Ontario and Quebec in the first time round.
Oh, you mean having a trial by fatality,
exactly,
as Ontario and Quebec had last fall? Possibly, but that is also on people who live in those provinces. The fact that the first wave spared some provinces more than they did other, it certainly instilled a sense of false security. But I'm with Althea on this. I don't think this is a great time to pick premiers as in someone deserves a prize, because I believe they're all trying very hard to find the right balance. And the right balance is not only counted in cases, it's counted in your capacity to keep having the confidence of enough people so that whatever you need to do in January, February going forward will still have some impact on your audience. On that basis, for sure, Alberta stands out for a majority saying they disapprove of Jason Kenney's proposal, but management of the crisis. But at the end of the day, they're all in a tough place. Christmas is coming. It's a nightmare. And they're all going to try to get over it as best they can, but there is no playbook for this.
No. Maybe you've both made the best point, though, and that is that it is really not about judging how they're managing it from a public health perspective, but whether their citizens are happy with them. And the other thing that public opinion polls seem to be showing, Andrew, is that Canadians' anxiety is growing again, much as it did during the spring. So I guess then the question is, what do Canadians look to their leaders for in moments like that?
They look for clarity, for one thing, and they're not getting a lot of it. I think there was, in the initial stages, a rally around the flag effect. Most of the premier's approval ratings went up at that time, and they've been kind of burning that off ever since. People are becoming more and more pessimistic. If you looked at the polls in June, there was large numbers of people who thought that the worst was behind us. That's much smaller proportion saying that now. Everybody's approval ratings have come down over time. I think when you look at individual premiers, it's partly measured against expectations. I think Manitoba's Premier Brian Pallister, for example, is suffering no doubt because of some mishandling of the case, some complacency. But Manitoba, for a while there, looked like it was going to have very low caseloads, and it's now exploded into the worst per capita numbers in the country. So that, when you're measuring against prior expectations, that's going to hurt you. I think in Jason Kenney's case, who's also doing very poorly in the polls, it's partly because the messaging that was put out by the Premier and his people was something to the effect of they didn't say it in so many words, but they were going to be kind of the Sweden of Canada. They were going to take a less harsh, less restrictive approach. Well, it hasn't worked for Sweden, and it certainly hasn't worked for Alberta either. So he may be getting knocked down for people feeling that he hadn't taken the whole thing as seriously as he might have. Although I think you have to look at also the economic situation in Alberta, which was terrible even going into this. And that's always going to hurt anybody who's in power.
That's a good point. And let me just also flag these new modeling numbers that we're going to hear tomorrow that we've reported on already tonight, that there could be 60,000 cases a day by year's end if people don't change, like if there's no change in behavior. And those are just projections, obviously, but that puts more pressure too on premiers to clamp down. And I would assume that's in part what the Prime Minister would want as a result of those modeling numbers. I think, Chantal, you want to go in, and then Althea.
I just want to be specific on the 60,000 number. It's not if behavior doesn't change, it's if we increase our contacts, as most people might be tempted to do over the Christmas break. The numbers, if we keep on doing what we're doing, are staggering enough, 20,000. And that is why Christmas is a nightmare. You can clamp down, but you're not going to go into every house to see if people are not having private gatherings. And the experience of the fall has been that the more you clamp down on public gatherings, the more you are courting private gatherings. You said the anguish of Canadians is rising. Well, that's probably good news from a government's perspective, because if people are scared, they're more likely to do what they need to do, which is limit their contacts.
Yeah, thank you for clarifying that. You're quite right. It's if we all go and have a great Christmas with our family members that things will get much worse. Althea.
I think the government is actually worried, and the governments across the country are worried that people are not scared enough. I think what we are actually seeing this week and what we're going to see tomorrow with these numbers, and what we saw today with the Prime Minister bringing in the opposition leaders in for a briefing with Dr. Tam, is to get the message across to everybody that we do not have a control over this virus. Things are going to get a lot worse, and people really need to change their behavior. My sense is the politicians feel like the people need to be scared, and they're not scared enough at the moment.
The last word to you, Andrew.
I think, unfortunately, some of our leaders have contributed to that fear. We were in the spring, there were cases of absurdly restrictive policies where people were being prosecuted for playing soccer by themselves in the park. Lately, we've been having, it seems to me, incomprehensibly lax measures where we're still allowing gatherings of, depending on the province, of 25 people. That seems to me to be remarkably improvident. It's extraordinary to me that BC, for example, is only now getting around to making masks mandatory. We're having tough debates about when and whether to close schools, which ought to be kept open to the degree that it's physically possible. But meanwhile, we're still leaving bars open. We're still, in some cases, allowing indoor dining. You know, there's been a lot of randomness and no rhyme or reason to where we're clamping down and why. And I think some clarity and some reasonableness in the rules would help a long way towards assuaging people's fears.
Okay, got to leave it there for tonight. Thank you all, appreciate it. If you want to listen to all of that again, or if you want to hear extra content, be sure to check out our podcast for that extra content, including the panel's take on this important story this week.
Just like with COVID-19, ignoring the risks of climate change isn't an option.
Look for it on any major podcast app and on our website, cbcnews.ca/thenational. And now back to Andrew and Adrian in Toronto.
All right, thanks, Rosie. Ahead tonight, the remarkable high schoolers who pushed Yukon to make history.
First, though, a marketplace investigation. Why are we still seeing big price markups on pandemic essentials? Welcome back. If you've noticed your grocery bill going up since the pandemic started, you are certainly not alone. Our colleagues at CBC Marketplace have been investigating complaints of price gouging for all sorts of pandemic essentials. Here's Asha Tomlinson.
We need the products, but
many Canadians say they're being gouged when they shop for essentials.
The toilet paper rolls that we can get like for $8, I kid you not, we're looking at prices of upwards of $32.
I think it's kind of ridiculous how far price gouging has really gone.
The same products come up again and again at most of the big chains. Disinfectant wipes, toilet paper, hand sanitizer.
Your raw material to make the actual formulation has skyrocketed.
Paul Kodrish manufactures medical-grade hand sanitizer. He says price markups should be no more than 30%. We show him what we find.
$9.99, 8 ounce.
It infuriates me.
Infuriating why?
Because it's gouging.
But this is 1 liter,
Yep.
$34.99.
Yep.
On store shelves, your product.
Yep. That's unacceptable.
Canada's premiers promised to crack down on price gouging, from Jason Kenney to John Horgan to Doug Ford.
You're hiking the price 5 times, 10 times what it should be. You're done, you're gone.
But there's still no law that limits how much prices can go up.
I'm hoping someone does something to take a stand against it.
Quebec's Consumer Protection wanted an investigation. The government said no. Alberta and BC tell us it's really hard to define price gouging. Ontario says it'll keep an eye on the situation. As for the retailers, they say product shortages, their suppliers, fluctuating exchange rates, and shipping costs are all reasons for higher prices.
All of those things add to the cost.
Meantime, Kodrish is taking action. He stopped selling to the distributor that he says overpriced his product.
I don't think in a time of crisis that you need to make the same margin you've made in the past.
Asha Tomlinson, CBC News, Toronto.
And hey, you can watch the full investigation on CBC Marketplace tomorrow night at 8:30 in Newfoundland on CBC Television, or you can stream it on GEM.
We'll be right back with the Yukon teenagers who changed the law.
I want to help make the change that should have happened a very long time ago.
They fought for years and they won, and they say they're just getting started.
I'm Jamie Poisson, and tomorrow on CBC's daily news podcast Front Burner, Vancouver's mayor wants simple possession of illicit drugs decriminalized in his city. Can it happen? And what change would that have on the policing of drug users? Subscribe wherever you get your podcasts.
Welcome back, and welcome to a story of what high schoolers can do when they put their minds to something. When a group of teens in Whitehorse found out conversion therapy was legal in Yukon, they vowed to change it. Danielle D'Entremont has their story of dogged perseverance.
It began in here, high school hallways, when two students learned more about conversion therapy, harmful practices trying to change someone's sexual orientation or gender identity.
When was conversion therapy banned in Canada? So we looked that up. And it had only been kind of protected against in a couple cities, a couple provinces. And the Yukon wasn't one of them, which really broke our hearts.
Soon, their school joined forces with another local high school, Porter Creek Secondary in Whitehorse. And then the work began. The teenagers lobbied politicians, protested, spoke with media, got hundreds to sign a petition. And 2 years later, their effort became law.
Results are 17 yay, nil nay.
Declare the motion carried.
They changed the law. They're the reason why this got put in place. It wasn't on my radar. It wasn't on government radar.
Jason Cook took a group of his students to see history being made at the legislature.
This is something that a group of kids accomplished. You never hear that happening. A group of kids did something super powerful.
But many students say this is only the first step of many.
I want to help make the change that should have happened a very long time ago. I want to help with the rest of Canada banning conversion therapy, maybe the rest of the world.
Ontario, Nova Scotia, and PEI have all passed similar legislation. Yukon is the first territory to do so. And while conversion therapy is still legal in Canada, last month federal Liberals reintroduced a bill that would nationally ban the practice on minors. Danielle D'Entremont, CBC News, Whitehorse.
And next on The National, a viral video from Nova Scotia and the man behind this raccoon feeding frenzy. Next in our moment.
Hey, everybody back here, you get one under there, you got it?
Well, he's known as the Raccoon Whisperer. This video went viral earlier this month, and you can pretty clearly see why. Jim Blackwood has been feeding his backyard raccoons for years. Now he's an unlikely YouTube sensation, but there's also a story behind this tradition of his that's worth sharing. It's our moment.
My wife died in 2003, and I raised Rascal for the next 13 and a half years. We've always named him. That's a good girl. Here, Blackie, here. Sammy's my favorite. He sits on the bench with me, and I rub his head and his back. And that's what I named my site, The Raccoon Whisperer. But I didn't start filming until about 2009 I started. My mob with raccoon video, that's viral. That's 11 million people watch that. I'm gonna sit in the snow-covered bench. Holy smokes! I have people all over the world been watching me. An unusual thing that's happened to me, and I hope someday that they don't show up,
So we got to start by saying, he says he knows he shouldn't be doing this. And the Nova Scotia government has pretty clear guidelines on this, that you shouldn't be feeding wildlife in the city. But he also says this was a promise that he made to his late wife, that he would continue doing this.
Right. He's a former RCMP officer, and he clearly gets something out of this, a connection point. He says he he's on the computer maybe 14 hours a day, reaching out to all the people who have reached out to him, and that connection point is clearly really, really important. That is a national for November the 19th. Good night.
Good night.